Hi, and welcome to the Autoimmune Dietitian YouTube channel. For those of you who don't know me, my name is Annie Rubin. I am a registered dietitian, nutritionist, and owner of Annie Rubin Nutrition. It is a private practice that I run out of my home virtually. And I work with adults struggling with a host of symptoms from underlying inflammatory and autoimmune conditions, things that include pain, digestive challenges, fatigue, and just a reduced quality of life. So in my work with my clients, I help them implement a personalized nutrition roadmap designed to improve mobility, concentration, and energy levels to help them live the life that they should be living. So we all know that inflammation is the root cause of many chronic diseases, including autoimmune diseases. And while there are a number of medications that help keep inflammation at bay, what you eat can be extremely effective in reducing inflammation. So today I am discussing some of the ways diet can help manage autoimmune disease. So before I jump in, I just need to attach a disclaimer to the video that the information in today's talk is not the treatment for not a substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes to your medical care. So how do anti-inflammatory diets work? The goal of anti-inflammatory diets, or eating patterns, is to ultimately reduce inflammation by using food. While the mechanism of how food does this is not quite clear, there are certain components of food that have special inflammatory fighting properties. These eating patterns also encourage variety. And by eating a varied diet, you are exposing your body to a multitude of nutrients that together may provide immune-boosting support to help fight inflammation. So for instance, many of these eating patterns, which I'll discuss in a minute, encourage a variety of fruits and vegetables. Fruits and vegetables contain a number of beneficial food components that fight inflammation. They are rich in phytochemicals, which are powerful antioxidants that basically capture and sequester free radicals to prevent cell damage and cell death. Fruits and vegetables also contain fiber, which is super important for your gut health and to promote a balanced microbiome. We all know how important that is. Anti-inflammatory diets restrict or limit foods that include high amounts of added or processed sugar, processed foods, highly processed fats and oils, salt, and alcohol. So you see kind of a common theme there is that it's a lot of processed foods. Many of these foods make up what we call the standard American diet. And there is a ton of research on the standard American diet, and it's linked to chronic illness. Most people following this type of diet eat a very calorie-dense, low fiber, low antioxidant, high sugar, high salt, high fat diet. So let's take sugar for instance. Eating a diet that's high in sugar and essentially low in fiber and other nutrients does a few things to your body. So first, it causes your blood sugar to constantly fluctuate, and this can trigger an overproduction of insulin to manage the erratic blood sugar. So insulin's job is to get the blood sugar out of your circulation and into your cells so it can use it. So when you are overproducing insulin, it leads to pretty big highs and lows in terms of blood sugar. And over time, if this continues to happen, it does two things. So first, it causes your cells to become insulin resistant. So blood sugar remains high. So your cells are basically not recognizing that insulin is trying to signal to them like, hey, there's a lot of blood sugar out in circulation, we need to pull it in. The cells start to ignore it because they're basically desensitized to the insulin. The second thing it does is it forces your body to store unused calories and fatty acids as fat in adipose tissue, which is your fat tissue. High blood sugar in and of itself is inflammatory. And an increase in fatty acids in cells triggers your immune cells to produce inflammation all over your body. So that's not very great for inflammation. Second, low fiber diets change the balance of your gut microbiome. Considering that 70% of your immune cells live in your gut, any dysbiosis or imbalance in your gut bacteria can cause a whole host of issues throughout your entire body, including more inflammation. And then lastly, diets that are high in processed foods, that increases your oxidative stress in your body. So oxidative stress damages your cells and is also linked to the development of many other chronic diseases, including atherosclerosis and cardiovascular disease. So now, it wouldn't be the end of the world if your diet was rich in antioxidants, because those antioxidants could basically sequester the free radicals, or all the oxidative particles that are floating around in your body, causing oxidative stress. But because with the standard American diet, you don't eat a lot of plants, your body has no defense mechanism to protect itself. So what are some of the well-known and researched anti-inflammatory diets or eating patterns? I don't like to use the term diet because to me that sounds restrictive, but let's call them eating patterns, because it's really a lifestyle change when you're shifting to a more anti-inflammatory way of eating. So there are a number of different anti-inflammatory eating patterns that have been shown to reduce inflammation. They are Mediterranean diet. So this diet emphasizes fruits, vegetables, monounsaturated fats, so think like olive oil, legumes, nuts and seeds, whole grains, seafood, and then limited amounts of dairy and red meat. This diet has been shown time and again. It's one of the most studied and researched diets. It's been shown to reduce several inflammatory markers. The second one is the MIND diet. This eating pattern is a mashup of the Mediterranean and the DASH diet. So the DASH diet has been used to combat hypertension, and it's essentially a low salt diet. So the MIND diet emphasizes whole grains, leafy greens, berries, olive oil, beans, nuts, fish, poultry, and limits things like fried and fast food, butter, cheese, red meat, and processed sugar. So one study found that those following the MIND diet had significantly reduced rates of Alzheimer's disease, which is a pro-inflammatory disease or condition. The third one is the Paleo diet. So the Paleo diet, people tend to think of that as like the caveman diet where you eat lots of meat. It's actually not true. The Paleo diet is a whole foods diet that focuses mostly on fruits and vegetables, nuts and seeds, and the protein part, the seafood, poultry, red meat, that's kind of, a smaller portion of what you're eating. So the Paleo diet has been shown to be as effective as a Mediterranean diet in reducing oxidative stress and inflammatory markers. The next one is the Autoimmune Protocol. So this is a very strict version of Paleo that further restricts. It takes out basically nuts, seeds, caffeine, chocolate, and nightshades, along with gluten and dairy and grains, all grains essentially. So the AIP is how it's called. It's really used as an elimination diet. So you cut back everything and then you slowly reintroduce foods to test your tolerance. And then the last one is the Wahl's Protocol. This emphasizes hitting certain food group targets. So there are actually different phases of the Wahl's Protocol. One kind of mirrors the Mediterranean diet, one mirrors Paleo, and the last one mirrors more of a ketogenic diet. But again, the emphasis is on making sure you're eating different foods in different quantities. So it kind of requires you to eat daily, 3 cups daily of colorful fruits and vegetables, 3 cups of leafy greens, 3 cups of sulfur-rich veggies, which include things like cauliflower, cabbage, onions, garlic. And then weekly, you should eat 12 ounces of organ meats per week, 16 ounces of omega-3 rich proteins, so think like salmon, sardines, mackerel, and then fermented foods. So what are the results of, anti-inflammatory diets and autoimmune diseases? Like, have they been helpful? So I have a few specific studies that have shown improvements in autoimmune diseases and or quality of life from the following anti-inflammatory diets. So a single blinded crossover study of 50 patients with rheumatoid arthritis saw improvements in their sedimentation rate, which is an inflammatory marker, after following an anti-inflammatory diet for 10 weeks. This diet included fish, vegetables, fruit, whole grains, legumes, low-fat dairy, and probiotics. The next one, a randomized controlled trial of the Crohn's disease exclusion diet, which is essentially a whole foods diet, with or without enteral nutrition. Enteral nutrition is basically like tube feeding, so formula. So after 6 weeks, 25 of the 40 patients achieved clinical remission. this diet is broken into 3 different phases, with the first phase having the goal of inducing remission. So the first phase is 6 weeks long and is the most strict, which is why typically they supplement with enteral nutrition to make sure that you're meeting your nutritional needs. But it essentially limits processed foods, sugar, foods high in soluble fiber, and processed fats. And then lastly, a randomized controlled trial of 100 multiple sclerosis patients following an anti-inflammatory diet for 12 weeks saw improvements in fatigue scores and their IL-4 levels, which is an inflammatory marker. So some studies, have seen improvements in quality of life, but not necessarily improvements in disease status in terms of like lab values. And some studies have shown improvements in lab values. So, again, I always take these studies with a grain of salt. What's really important, I think, is that people feel better. So whether or not it changes your lab values, if you have more energy, if you feel better, if you feel healthier, then I think it's totally worth it. So anti-inflammatory diets are not as intimidating as they sound, and they can have a pretty significant impact on your autoimmune disease. The trick is to find one that works for you. So my advice would be to start off with the easiest, like the Mediterranean diet or the Mind diet. That's like the least restrictive. And try that for, a few months. And if things don't improve, then move down to try one of the more stricter diets. I always do recommend that you work with a professional to make sure that you are optimizing your nutrition and doing reintroductions in a methodical way, because that can be a little bit tricky. So that is it for today. Thank you so much for joining me in my talk on anti-inflammatory eating patterns and their effect on autoimmune diseases. If you have any questions, feel free to reach out to me. My email is in my bio. You can also reach out to me on Instagram. I'm on Facebook. You can go to my website and book a free discovery call if you want to, learn more about working with me one-on-one or in a group setting. But, if you like what you saw, please hit subscribe. I come out with these videos every week. So I look forward to the next one, and have a great day. Thank you.